everyone knows what a doctor is. Everyone knows what a social worker is, like a dietitian, you name it. But no one knows what a public health person is. I think that's purely because throughout history, we don't advertise. Mm-hmm. And I think that needs to change. And then until the people up the top of public health, and like until they start and wait, until they change and start actively advertising, we're going to have the same issues. Yeah, you, me, Public Health Insight, all those sorts of groups, we do our part, but in generally speaking, we need more than just podcasts. We need more than just videos. We need even just the government. I mean, like, you name it. It's like we can't. Essentially, the idea is just to push a little bit, but like I can't do it by myself, so to speak.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Welcome to episode 122. Hi everyone, Omari Richards here. Thank you so much if you're rejoining me here. And if you're new, welcome. Be sure to subscribe so that you don't miss any other great public health information, any other public health careers information. Today's episode is amazing. I really enjoyed the conversation with the student who has two podcasts, one around public health, one around veganism. And I really like how he explains his path into public health and how he's doing a lot of the work as a student and taking it upon himself to speak up in situations, which has led him to become a student representative for his university. And I look forward to seeing what he does with the future food systems in this world and what that looks like. So be sure to follow his podcast and to enjoy the episode as well. Today, we have someone who has completed a Diploma in Nutrition as he leads up to a degree in public health. He got a Diploma of Nutrition from Torrens University Australia. He's a current student at Flinders University, getting his Bachelors of Public Health. He is a student representative at Flinders University and hosts two podcasts, the WTF Vegan Podcast and Public Health World Podcast, where I've been previously interviewed. Find him on Instagram at WTF Vegan. We have Jamil Locker. Welcome to the show.
Hey, Amari, thanks for having me. It's awesome to be here. So yeah.
Yeah, I'm glad to repay the favor. You had me on your show. I think it's about time that I had you on my show. And I think it's even more interesting because you're a student, you have two podcasts, and we're going to get more into that later on. But these are the things like I look back into my career and I wish like I did this earlier, even if it's not something that I continue doing or if it's something I try and just into a new podcast. I think the skill sets and being able to meet people and network through podcasting is an awesome way to do it. So kudos to you. And how are you doing?
Yeah, no, I'm good. I'm on midterm break, so to speak. So we've got like in Australia, I don't know how it works in America, but in Australia for university, which I think is the equivalent to your college. I'm not 100% sure how that works in Australia. But basically, it's split into two terms or semesters, and each semester has like a 2-week break in between, 2-week break in the middle of it somewhere, which is kind of like a break from classes, but not really a break from schoolwork. Whereas in the middle, you've got a 4-week break halfway through, like to split the two semesters up, which is like a full break of no school, nothing. So I've just come off. I'm on the first week of that break, so yeah, I'm going pretty good. Bit of schoolwork to do though.
That's fair enough. I hope that you're able to enjoy your break as best as possible, get some downtime, and very familiar with the semester system. I think it's like it resonates a lot with like Trinidad and Tobago because I'm guessing the British influence both
every other country in the world.
But, like, not the US though, but
that's right. Yeah, that's right. Pretty like every other country in the world other than America.
Yeah. So we have decently similar systems, schooling systems here and there. So completely understand that. And interested to hear about how you got into this, how you got into like public health, how you got into podcasting and all of that. But before we get there, I wanted to ask, how do you identify, and then tell us a little about your personal background?
And so I'm a white Australian male, straight, and my personal background, I grew up on welfare, what we call Centrelink, in Australia. I grew up very low SES. Partly grew up in rural areas, so like very country, cattle farming, that sort of thing. Was kind of my family's background originally. And then as time went on, we ended up, so I grew up in the Snowy Mountains, which is near Canberra, which is the capital of Australia. And then when I was 11 or 12, I moved to Tasmania with my family, with my dad and my younger brother. I also grew up around a lot of drugs and crime and things like that, which, like, looking back at, kind of also led me to a lot of, today has now led me to a lot of sort of public health revelations and things like that, of just purely because of my history. So yeah, it's quite cool to think about that too. I love travel. I've spent the better part of 3 years after I finished high school traveling around Australia. I also spent a year in New Zealand, and I was playing guitar as a street musician, or a busker, as most people call it. Most of Australia and New Zealand, and that was my main source of income back then. So yeah, I did that for a fair while too. Other than that, yeah, a podcaster, I suppose.
You suppose you got 2 podcasts? That beats me. No, but that's great, and I'm glad to hear the reflection of like your lived experiences and how that kind of shaped who you are, as well as shaped the work that you want to do in the world, which I think is important. So I appreciate you highlighting that. And then to the point of like traveling, what's your favorite place in Australia?
I think if you had 1 week, I can't choose one place because each place has its ups and downs. Mm-hmm. All I'm going to say is don't be cliche. Stay away from Melbourne. If you want to see a place that's like Melbourne but way better, go to Germany. Go to like Berlin or something. It's far better. I always recommend Sydney. Once again, it is kind of cliche, but it's a lot nicer. It's very iconic. I find I spent the majority of my time traveling there. I also did my certificate. I did a certificate of nursing there a while ago. That's not in my LinkedIn, which is why you haven't got it there. I forgot it there and completely forgot about mentioning it. But I did a Cert 3 in nursing, like an AIN assistant nurse, which kind of led me into health originally. I would suggest going from Sydney to Brisbane, up the East Coast. It's probably my favorite trip. I've done that every way you could imagine. I've hitchhiked it. I've taken buses. I've taken the train. I've flown it. I have kind of almost walked it because of that hitchhiking sort of thing. So I've done that side of it too. Absolutely love it. But I would highly recommend that sort of a week to go up the East Coast sort of thing. So that would probably be no, the equivalent would be in America, maybe from maybe the top of Florida down to the bottom of the Key West on the very, very bottom?
Yeah, Key West.
So something like that would kind of be the equivalent distance,
okay,
give or take, because a lot of people don't realize how big Australia is.
Yeah, it's massive. It's its own continent in some context. So
it's the only country in the world that is a continent and an island. It's correct. The biggest island and the smallest continent.
That is true. Which brings very unique animals. That's why a lot of people like to go to Australia. But anyway, regardless, appreciate that. We'll definitely, if I head down to Australia anytime soon, we'll take you up on that Sydney to Brisbane tour of the East Coast, and hopefully I get to meet up with you and different things like that as
Oh,
well.
you might have to fly a bit further. I'm over in Adelaide at the moment, and so and it's not with a bachelor's degree of public health. That's actually good.
Understood. Well, I'm glad that you're getting a good bachelor's in public health degree. And as we talk about that, what does public health mean to you?
I never quite know how to explain it, but I think for me, it's kind of everything. I know like you get that a lot on the podcast, but like when I try to explain public health to people, I don't know how to explain it because we don't fit into a category. If I were to get a PhD, it's not a PhD in health, it's a PhD in philosophy. So that alone kind of shows that it's like not really a health. It's not really a like generally speaking when we talk about it. And I think for me, every little piece of health, kind of like every health qualification, every health degree kind of rolled into a little bit here, a little bit there. And we're kind of the ones who kind of without us, I think the whole health system itself kind of falls apart. And not just the health system, but like other systems as well, which are inherently public health systems, like epidemiology, for instance, or something a little bit more different, but like sewage or traffic lights or education, or like basically it is everything because it fits into every category. So that's why it's like hard to explain to people what it is because it is everything.
Yeah,
So,
yeah, definitely agree with that. And I think that if a lot of people were more able to maybe identify themselves as public health professionals or working in public health, or just had a mindset focused more on public health, we would be a lot further along in like just health improvement, health promotion, disease prevention, etc. But to that point of it being just kind of hard to define to most people, and saying that it's everything is kind of like, oh, well, what does that mean to people is at the same time. So that's why like I'm happy to have these conversations, to share this podcast, share this platform so people can share their perspectives and share how they got involved in public health.
I think as well, I don't want to really call it an issue, but another thing that might help define it is if we had an exact definition. Just like global health and public health, there is no clearly defined definition. Yes, in public health especially, we do generally go for the World Health Organization's opinion of it, but global health doesn't have a single exact definition. Not even the World Health Organization has a defined definition of global health. So even that alone, it just makes it very hard to. How can we define it if it's not defined in itself? Is kind of what I'm getting at there.
Now a quick break from our show sponsor. Have you been interested in connecting with a community of people who are passionate about community health while working on improving their own personal well-being? Well, lucky for you, the Community Health and Wellness Discord server is where you want to be. It's a free online community I co-created just for people like you. You'll find friendly people talking about important public and personal health topics, asking amazing questions, sharing valuable information, while connecting with each other to build a better culture of well-being personally and at the community level. Join this free online community by going to thephmillennial.com/join. That's thephmillennial.com/join. See you there. Now back to the show. Yeah, absolutely. And I think to that point, it makes it hard, but it also gives us the flexibility to fit it into where we see fit, which I think is important. So yeah. So you just stated that you got a certificate of nursing, and I know that before you got your Diploma of Nutrition, you started the WTF Vegan Podcast. So which one came first? Did you go into nursing first? Or?
So the nursing and the podcast the podcast just came a couple of weeks after my nursing program finished. Heavily leads into everything kind of thing. So basically when I just finished traveling, so I'd done 3 years of travel and it was starting to burn out a bit with travel. It was very difficult. I was living paycheck to paycheck, playing guitar on the street. So I was saying, yeah, a bit heavy for me. So I started looking at things I could do, and I always had at least a little bit interest in healthcare, but I also had a interest in like sort of in hospitality and things like that. So I actually flipped a coin, and if it was heads, I would have actually become a chef. But because it was tails, my life completely changed in a way I probably would have never expected. So I decided, as I flipped a coin, it was tails. So 2 months later, I was doing a certificate 3 in nursing, which is kind of like a assistant nurse program at a technical college, or a TAFE as we call them in Australia. It was quite interesting because I'd done a lot of first aid stuff in the past, things like that. I was an army cadet, so I had like basic experience in it. But the more I started looking at it, the more I started seeing these little flaws. And this was kind of like my first realization that though I envy, like, kind of, I love nurses and like that sort of thing, I realized I couldn't do it as a career. However, at that same time, I was learning about heart disease and cancer and diabetes. And one of my assignments was to look at prevention. It was only a tiny, tiny little thing. It was like I think it was a 300-word thing on heart disease prevention. And I came across this one little thing which led me down this huge rabbit hole of veganism. And in particular around like preventing heart disease and cancer and diabetes and even like dementia and all these other different things. And it was called the China study. It's the largest study ever done between diet and nutrition. And what it showed, so this is a fair while ago, but it's still the largest study ever done. And it literally showed that pretty much everyone who ate this high carbohydrate, whole food, plant-based diet in China, just as fast food was coming to China, so like the westernized diet, we literally saw anyone who started to increase their meat consumption of any type of meat, same with dairy and eggs, we saw a rise in chronic disease, like tenfold in some cases. That was like breast cancer, prostate cancer, diabetes, heart disease, and you name it. And as we know now, China has now gone from being a very, very, very healthy country in most regards to being one of the most obese countries in the world in a span of 2 decades, like since the early 2000s, which is like crazy. So as we can like clearly see, that sort of how diet has played a role in a place like that, it led me to kind of do this trial of veganism. And as much as I like the nursing, I realized that because they don't focus on things that they focus on a lot on the people rather than the causes, like for instance nutrition and things like that. At this point, I still didn't know what public health was. See, I originally thought what I thought later on, as you'll hear, I thought nutrition. That's why I thought public health was nursing. I mean, it is, but I thought like in itself, what I wanted to do with my life was actually public health health promotion, not nursing. At the time, I didn't register that. It wasn't until I decided to give this veganism thing a try. And I did sort of I think it was a 1-month trial. And before that, I'd eaten meat pretty much every day of my life. Thought it was normal, needed, necessary, all the other words, so to speak. And then I gave it a try and I actually quite liked it. But I also, for the first time since traveling, I found a group of people I could kind of talk to and things like that. And I became an activist. And I'm still pretty heavily involved in animal rights activism and even politics to some extent. So it's quite interesting to see how this one change in my life led me down this huge path. But first it was nursing, but the bigger change was actually the veganism. When I changed that one perspective, it changed my perspective on a whole heap of other different issues. Like I was very right-leaning politically speaking wise when I was younger. And then that changed very quickly once I started like once that sort of veganism thing happened and everything like that, it kind of all rolled into this one big pile, so to speak, and all in one sort of 6-month period. And that's where you go into my WTF Vegan Podcast.
To that point of you saying, I guess one thing led to you changing your perspective on the world, and then that had trickle-down effects into the things that you were passionate about and just how you showed up in the world, which I think, like for many people, that might be, it might be coming into a public health class and learning something like that. And for you, it was learning about the veganism and the China study, which is a book that I have actually outside that I haven't read as yet, but I need to read. But definitely realize a lot of that there. So yeah, you can continue. So
yeah, the China study. I read the book recently. It's really good. Well, I listened to the book technically, but kind of the lead up to the podcast, I just finished my Diploma of Nursing. My Set 3 of Nursing, and I was like, what am I going to do now?
Let me stop you there. What year did you finish? What year was this happening?
Oh, what year? What was last? Wait,
2020.
Not last year, the year before.
2020.
2 years ago. Yeah, that sounds right.
Okay.
Yeah. I think. Trying to test me.
2 to 3 years ago.
Yeah.
Okay.
Yeah, because this is going on to the third. Yeah, because I just 2 years ago now, I would have just finished my nursing degree. So yeah, 3 years ago technically. Okay. I had just gotten heavily into podcasts. I never really liked them in the past, but I'm very auditory learner, and I always kind of knew that. And because I have slight autism, and I'm also slightly dyslexic, I'm not the best with books. I get bored, and especially if they're not interesting straight away. Whereas I find podcasts, audiobooks, things like that, I can do other things at the same time, so I'm more likely to listen to them. And I started thinking I'd been curious about podcasts for a while at that point, and I kind of toyed with the idea with a friend. I just mentioned it, and he said I'd be your first guest if you want. And it was like, oh, okay, this is actually going to happen now. Someone's actually interested in doing this. For me, part of it is I struggle with the written word. I'm not the best with putting words from my brain onto paper. I'm pretty good at speaking and articulating myself through speech. But yeah, and once again, practice, I'm now a lot better at writing than I was back then, mainly because I hadn't really done an essay really ever that I actually enjoyed until I started actually wanting to actually do it. And also things like audiobooks and reading and things like this also help with my brain as well, with thinking and writing and all that. But yeah, so I was doing activism. I was doing it at one point there almost every day. So I was I don't know if you've ever I don't know if any of your viewers have ever seen the people with the screens on their stomach in a cube shape. Anonymous for the Voiceless. So I used to do activism with a group very similar to that in Sydney, and we used to go out 4 times a week sometimes. Different people would organize it each day, but you have a set sort of a group, so to speak, who I became quite good friends with, and they miss a little bit because I've moved away from Sydney now to study. Yeah, no, it was kind of looking at what do I want to do? How can I get, because at that point I was looking at nutrition. I just started looking at nutrition as a viable thing. And I was looking around at diplomas for nutrition because I hated high school. I didn't have the points or the ATAR, I don't know what you call it in America, but the ATAR to get into university because I didn't want to when I was young. So I had to kind of go this long route of doing certificates and things to actually get to that point. So I thought I'll give this Diploma of Nutrition a try. And because it's at a university, I could get a direct entry and 6 months off my degree. So the idea with a lot of degrees in Australia is the first 6 months you actually get get it completely cut off. Oh, sorry, is that right? So after the first 6 months, you could leave and you generally get a certificate of some form. Okay. So even like the Bachelors of Public Health here, I could get a certificate of public health. Right now, I technically have a certificate of public health if I wanted to leave tomorrow. So that's kind of the idea of these sort of diplomas, so to speak. Except my one was a bit longer. My one was a year. So I did that last year. And kind of all rolled into one. I started looking at like, how can I talk to interesting people, get contacts, things like that. I always believed, partly because of my dad, that often contacts are better than money. If you know the right people, like a lot of things can happen for you. It's not, in a lot of cases, it's not what you know, it's who you know. And at that point, I didn't really register what I was doing. It was kind of just something I could do for fun, meet some new people, things like that. And I just started it up. I spoke to my mate for the first one. It wasn't the best, but I learned from a lot of mistakes and things like that. And he came back for another go later on. I asked more open-ended questions, things like that. Absolutely phenomenal the second time. I've spoken to some really awesome guests, activists, fitness, like people leading in the fitness industry of veganism. I've spoken to a few political people, a few others as well, some YouTube influencers and things like that. So I've spoken to a fair few people. I suppose at that point, I didn't even know why I was doing it. It was kind of just something to do, so to speak. And even now, I mean, I don't necessarily do the WTF Vegan one as much anymore. I've just done my first one in almost a year. Because I've been pretty much focusing, trying to get contacts in public health for eventually to actually set up my public health world one good. So I can essentially have rolling guests rather than having patchy guests, because I hate doing solo podcasts. I don't know how to do them. It feels wrong. You know, I think you can get what I mean. And I hate scripts. And because I hate scripts, I'm not very good at doing solo podcasts. People who are good at scripts and can follow a script, it's great for them. So I suppose, that's kind of how I fell into podcasting and kind of the almost getting into public health there.
Yeah, I appreciate you sharing that, and definitely is very helpful. I think to that point of you not knowing what you're doing the podcast for is, as you said, you're trying to build a network, as well as it's a space where you feel most comfortable, as you shared, like you feel most comfortable when you're speaking to people. So I can see why that is something that attracted you, and then being able to just reach out to guests and have those kind of conversations, I think is something that's always impactful. And as someone who was a student at that point in time, I think that, like, huge kudos for you, because I think that many students aren't thinking about what other things can I do. And I think you probably came into it at the perfect space, like podcasting, to continue to learn and build. And look forward to seeing how the other podcast, Public Health World Podcast, continues to grow. And we'll chat a little bit about that in a second. So what was the thought process more so about getting the Diploma of Nutrition at Torrens University Australia?
Yeah. So I did touch on it slightly. So I started looking after my nursing at, like, what could I do? It kind of, once again, related to the veganism a lot as well. I realized that this is a thing that people need to know. It's something that I now believe is actually the future. And I heavily see it in certain places like England. So I kept on looking at, like, well, what could I do? And I suppose I kind of realized that I needed more like actual nutritional knowledge on veganism. And that was partly for my own education, because as soon as I became vegan, everyone around you becomes this nutritionist. It's a big joke in the vegan community, where if you become vegan, all your family, all your friends, like everyone who isn't vegan is like, what about vitamin B12? What about this? What about that? Stuff they've never even heard, like never even mentioned before.
Yeah.
And then as soon as it's like, there's another one, there's a meme of like with your whole life, your parents tell you to eat more vegetables. You go vegan and then they argue about it, which is always like a funny one to like see and things like that, which is kind of like that whole kind of also why I started my Instagram as well, was kind of like a way to show recipes and things like that, how easy it was, how easy it is, sorry. And then also kind of, and that also started around the same time as the podcast, I think a little bit earlier than that. But no, as I said, it was kind of like with the diploma, it was weird because it was, well, first of all, it's completely online, which I'd never done before, other than my last 2 weeks. So this is COVID. This is in Sydney. This is early 2021 when I started this, for a bit of context there. And as I said, I just kind of wanted to educate myself. It wasn't so much of it was a possibility, well, I might end up as a dietitian. But I think I kind of knew in my heart that that was not going to be the case. It wasn't something I really thought about consciously until my first day, first class. And I had this class called Public Health, called Nutrition and Society, which was literally a public health nutrition class. And to this day, other than now, it's been the only class in my nutrition that I got a HD in, like high distinction in, which is like I don't know what you called it, if it's something different in America, but it's like the highest mark you can get for a subject. So to this day, it's like still it was very eye-opening. Like I learned about Jon Snow and the term upstream solutions and things like that. And I already knew about this. Like I didn't register that I already knew about this stuff. Like this is stuff I thought about at the age of like 10 years old, like just sitting on a school bus. It was like I used to think about like things like natural, like I was a bit weird as a kid, but like I always thought about things like natural disasters and things like what would happen like if we all kind of died, like if like something happened and like we would have to like fix the world or something, like just randomly. When I was younger, I'm like just bored. I had a very active imagination. So but yeah, no, it was kind of like I don't know. As I said, it kind of, I didn't really have a thought process as such, other than the fact that I kind of just I wanted to explore my options. I'm still pretty young, but even at that point I was younger. It was what, 22, I think, or 21. Yeah, it's 22. And it was like, well, I need something I need to do something in my life. I needed to work out what that was. So I was just exploring different career options and things like that. And yeah, as I said, and I just happened to come across this subject and felt instantly in love with this idea. About 6 months later, I started looking at not diplomas, at bachelors, some form of Bachelors of Public Health, if there was even such a thing. I didn't even know. But I started looking at that. Yeah,
I really, really love that. I love how like you moved from the China study and understanding the effects of like Western food and meats on our bodies, and how that led you into wanting to learn more about veganism as well as nutrition. And then you dig into this certificate of nutrition and you're learning more about it. And then you get this one class that is nutrition and society, which is essentially public health nutrition, which like, okay, wow, these are things that like I thought about as a child. And I have like lived experience that reflects different things around this public health landscape. So the question I wanted to ask there was, when did you get the word public health in, and wanting to know that you wanted to like pursue a degree in public health? Because as you said earlier, it's everywhere, but then at the same time, because it's everywhere, a lot of people just don't know about it.
So I was very lucky. My teacher who ran that class, he is a public health nutritionist. So he was very open in that term. It's something I'd never really heard of before, But I started looking into the word public health and started like realizing that a lot of the things I like, community centers, like looking at all these different things that I kind of grew up in, like living in, I did not have a good childhood. And because of that, and especially home life, like I had a lot of issues with my older brothers surrounding drugs, my younger brothers surrounding crime. So like I didn't have the best childhood in that sense. And because of that, I kind of I ended up in a lot of youth groups. I ended up in Army Cadets. As I said, I was away from home on purpose for a long time. Most of my teens, I left at 6. I'd walk to school to prolong so I didn't have to be at home essentially. And then I wouldn't often, sometimes depending on what I had after school, I wouldn't get home till sometimes 9 or 10 o'clock. So I was like out all day sometimes. And a lot of that was just like me subconsciously not realizing that I was kind of escaping my reality of where I was living, my situations. I suppose, yeah, no, sorry, what was the question?
I can't even remember at this point in time. It was something around where did you learn about the team public health
Yeah, I did that. Sometimes I was slight tendon. Yeah. So yeah, no, my teacher, my head teacher, he like for the nutrition and society, I think it might have even been the first day when we learned about Jon Snow. We learned about what public health was, and I love that idea. That idea of instead of helping one person, you're going to help an entire community, country, city. Doesn't really matter. But you're not helping one person, you're helping multiple people.
Yeah, I love that. And I appreciate you also sharing like your backstory of the lived experience of growing up and using those like whether intentionally or unintentionally taking time to like try to disconnect from an environment that that was not like as supportive as it could have been and things like that. Also awesome to see like where you are today and where you continue to strive to be despite that. Okay, so tell me more about your bachelor's degree in public health at Flinders University. So you said that you moved to you moved so you can get one of the best like public health educations in Australia. So tell me about that process.
So this time actually no, it's not July anymore. It feels like it is still. But okay, so around July last year, I started looking into, so this was just after I finished the subject I just mentioned, nutrition and society. And when I did, I started looking at kind of, do I still, like at that point, like when I first went in, I was assuming I was going into a doctor, like I was going to eventually become a dietitian. So I assumed I was going to do a Bachelors of Nutrition and Dietetics and then follow on with the Masters to become accredited. Boy, I was wrong. Once I got hooked on public health, I started looking high and low for a bachelor's. As we both know, I think it might be a bit different in America, but in Australia, they're very rare. There's only, I think, 3 or 4 of them in the whole of Australia. The others were on the East Coast and not that far away from Sydney, but they aren't really overly good universities, especially for healthcare. So when I came across Flinders University, I'd looked at that a long time ago when I was kind of like just browsing at universities, kind of like a kid, not assuming I was going to go to one, but just for something to do, sort of thing. Yeah, I kind of came across this one again. I once again, it's one of those universities. It's like it's quite hands-on. But the thing that really hooked me was the fact that they have the highest employment rate after university for people studying any form of healthcare than any other degree in Australia. So when I realized that, I was like, well, okay, this might be a good idea. When I applied, I got a direct non-competitive guaranteed entry. because of my undergraduate diploma. I basically got stuck. I got a bit stuck in Sydney though, because Sydney had a lockdown because of COVID around this time last year. And it was because it was Omicron, they didn't want South Australia to get it. So they completely blocked off Adelaide to New South Wales, unless you were able to afford the hotel quarantine for 2 weeks, which is only in select hotels and is deliberately for rich people. So poor people couldn't go back home. Love the socioeconomic status bias there. But no, so I was kind of a bit stuck, and I kept on having to delay my flight. And my Airbnb host, who I planned on staying with when I arrived, got a bit sick of me because it's like every sort of, I think I postponed my flight and my Airbnb stay like 8 or 9 times, just to, because I originally was going to fly halfway through the year. Because my whole degree was online, I could have just flown there. And that's why I originally planned on doing, but it didn't work. Every time I tried to fly, there was another lockdown. I eventually got over just before Christmas, I think. Yeah, it sounds right. So yeah, I arrived there. A couple of days later, I was in a really, really nice place for summer, 2 minutes from the beach. I stayed there like through the whole summer break, your winter break, for I think it was about 5 or 6 weeks, and then I moved, and then moved again recently. But yeah, no, I kind of so yeah, start of the year, started my degree, and absolutely I really liked it. I found there was a few issues, few kinks, so to speak, and I basically went straight away and started talking to the head teacher, who basically was like, yeah, this is true, when you're not wrong. And a lot of that was I didn't realize, but this is the second year this degree has been available. No, it's so new that no one has actually graduated from it yet. So I kind of, basically what happened was also kind of related to the student representative. Is the way I kind of became a student representative was I kind of I essentially offered it because there wasn't, like, the degree is so new, there isn't many people in the degree. There's only like 30 or 40 odd people in the degree, so it's brand new. A lot of the people didn't know why they were doing things, and it was a bit sort of, because it was new, they had, like, it's a lot better now, but at the start of the year, there was still those odd few kinks, and especially in things like anatomy, because it was all medicine based instead of looking at it from a public health point of view. People found it hard to relate them back to each other and things like that. And it was something I pointed out to both the lecturer and also my head public health teacher, and she liked the sort of things I was talking about and things like that. So she put out a request for anyone interested. I think I was the only one who put in. And yeah, no, it's quite cool because I can see kind of what's happening behind the scenes with public health as well in the school. I get to meet all the teachers, which also helps me if I want to do like podcasts with them and things like that, which I've done a few, and I've organized a couple as well for the future, very near future, which would be cool. The thought process of getting the degree was kind of like, I think at that point it was like, this is what I want to do. I originally thought public health and nutrition might be where I end up, but through podcasting and through just generally talking to people, I realized that I'm more likely to end up in public health communication and promotion, like having those two overlap, and then also using my past skills with nutrition to kind of integrate them, so to speak. So like looking at more at a community-based level at things like community classes for cheap vegan food, for instance, like looking at lentil bolognese or things like that. So looking at that side of it, and then also things like podcasting. I think I think the one thing I think across the board we need more of in public health schools is some form of media training. I think that's the one thing I think every school misses, other than Harvard Health, I think, is the only one that does an elective option for media training. I think that'd be really cool.
Yeah, that is awesome. If any school wants any support in building that out, let me know. My email is at thephmillennial@gmail.com. But I appreciate you sharing there. And I think it's both awesome in the reflection of inequities, disparities in when the lockdowns happened in Australia, and then they were the 2-week quarantines in the hotel, and just how it was only for people who were more affluent. And then I also love the perspective of you going into this program. And I think regardless of it, if it's a new program or if it's been around for 50 years, there are always things that can be improved. And a lot of times students don't want to speak up on that. But you going in there and sharing that there was a disconnect and that you are willing to help them make it better, I think is always something that professors, students, administrators at school are looking for. And I think those are these kind of students that kind of set themselves apart. Hence why you became a student representative and why you're in those conversations and trying to continue to help and support, build it and make it a better program, which is awesome.
Yeah, definitely. Yeah.
And you're also a podcast host for the Public Health World Podcast, which I've been a guest on before. So thank you so much for having me as a guest. You know, you would think I get interviewed a lot, but I do not. So I appreciate that a lot. So tell me about the thought process for starting this podcast.
Yeah, no. So I think for me, I always kind of have this weird feeling. I had it with my veganism one and even my Instagram of like this kind of, I don't know if it's a weird feeling, but kind of this unreal kind of fantasy, like one day this is going to make me famous, not like on purpose, but just kind of like goes into your head sometimes a little bit. And I think for me, I look at it from this point, and I think I look at it far more now of kind of like that sort of retrospect of why I want to do these sorts of things. And a lot of it's to gain awareness. No one knows what public health is. Public health world is generally aimed for people who are interested in public health, not necessarily already in public health, but it's for people, it's designed so people can understand the immense careers in public health, realizing that it's not just one job, but people don't even realize like you've got social work, which is technically a form of public health. I've been for the last couple of, since the start of the year, I've been trying to get a public health, social worker, policymaker and researcher who's down here at the school, who studies specifically youth violence, to come talk to me on the podcast, but our schedules don't align either. He does a podcast as well. So yeah, no, there's all sorts of other different sort of things. But I think for me, it's generally about helping people realize that public health is not epidemiology. I mean, it is, but it's not just epidemiology. I hate epidemiology personally. I don't understand the maths. It's confusing. I can't wait to finish epi, and then next term I've got biostatistics. But after that, I'm free. I can start doing the social science, the stuff I love, essentially. But yeah, no, it's like trying to essentially the idea is to just open up people to this realization that there's more than one career. Like people are starting to know what public health is, but people still think that public health is just epidemiology. And I think that's partly due to society, to older public health officials. Everyone knows what a doctor is. Everyone knows what a social worker is, like a dietitian, you name it. But no one knows what a public health person is. I think that's purely because throughout history, we don't advertise. Mm-hmm. And I think that needs to change. And then until the people up at the top of public health, and until they start and Until they change and start actively advertising, we're going to have the same issues. Yeah, you, me, Public Health Insight, all those sorts of groups, we do our part, but in generally speaking, we need more than just podcasts. We need more than just videos. We need even just the government. I mean, like, you name it. It's like we can't. Essentially, the idea is just to push a little bit. Like, I can't do it by myself, so to speak, or we can't do it by ourselves, so to speak, if that makes sense.
Yeah, that raises a really good point, because I think it is important that we are doing this, creating platforms to share the information. But at that same point in time, people actually have to actively search out for this information, as opposed to having the leaders in the spaces be more vocal and outspoken about what public health is and what you can do in public health. Because yeah, I still agree with you. People have learned a lot more about public health during the pandemic, but in a lot of respects, it's still people thinking that the epidemiologist is public health, but public health encompasses so much more than just that. And it's hard to figure out like a tangible way to make it visible for more people to know, because it's so hard to say, because a doctor, what a doctor looks like, but a public health professional could look like so many different things. So it's like, how do
like
you
a doctor?
exactly. So how do you like really market this? And I think that's one thing that I think about a lot. I'm guessing you think about a lot. And I'm glad that we're
Well, you'll like this. I've actually been at pushing my school to do high school trips. So you know how like when you're in high school you had your mini careers style expo with like all the unis and like all the different career, like all the different university what they called university not not subjects, courses you can do. That was something like I've been trying to push my school to do. They already do it, but they still haven't done it with public health. So I want to try and add public health to their agenda. So like I'm hoping at some point they will they'll actually look at doing that. I've offered my own services for that. They're also looking at going further north, like into something it happens even in America, but it's even worse in Australia, just purely because of the I don't know if there's a racial. I don't know if the term's racial disparity in this case, but so in Australia we've got a very minute population of Aboriginal people still compared to white Australians, and because of that, they have the most percentage-wise that more of them are jailed, more of them have health issues, more of them live in lower socioeconomic areas, things like that, like the racial disparity side. But so few end up in public health, end up in policy, end up in areas that can actually influence change for their people, for the world, things like that. And it makes it very hard to kind of like, we've got this scheme which we've been trying to do for going on almost 20 years now, called the Closing the Gap scheme. And they've been trying to do this where that, because there's such a huge, it's like don't quote me on this, but I think it's a 10-year age gap between Aboriginal people and white Australians for life expectancy, similar to African Americans and white Americans. And because of that, we attempted to do this initiative called Closing the Gap, and it's this huge policy type thing. But the issue is we haven't actually asked the Aboriginal people what they need. So it's like basically what the school is trying to do, hopefully going to be doing at some point, is essentially taking like a school tour up what's kind of like the middle of Australia. So there's a road which goes from Adelaide to Darwin. And our school has a footprint in Alice Springs, which is near Ayers Rock or Uluru, which you may have heard of, which is a big ass rock in the middle of Australia. And there's that whole area up that direction. There's a lot of remote and rural Aboriginal communities. Kind of need to learn about like the opportunities that they could have. And once again, in the past when they've done this, public health has not been public health, the degree, not public health, the issue, has not been talked about during these sorts of things. And I think that needs to change. And I'm hoping that at some point I may even get to go on a trip with them to talk about it. That'll be ideal. So yeah, that's kind of like the sorts of things. Like
Yeah, that I appreciate that. I do think it's important for high schoolers, maybe even middle schoolers, if you're in the US, like high schoolers.
Yeah.
Yeah, like younger people before university getting exposed to public health and what they can do in public health and the broadness of public health. Because as you said, we in high school, we know what a lawyer is, we know what a doctor is, we know what a nurse is, but we don't know what a public health professional is. And to that point, getting people to go into those classrooms and have those conversations is important. And then on the other point that you're making of they're trying to close the gap for these indigenous groups in Australia, but yet they are leaving out the groups and their leadership from being a part of the conversation and being a part of driving forward the solutions. And if we know anything about anything, that's just gonna lead to the same issues that are happening and maybe even exacerbating them.
Yeah. We were recently, say in my Aboriginal class, we were talking about the Aboriginal Studies class. We were talking about the feminism movement. And kind of those 3 stages of feminism movement and why, generally speaking, Black women, especially Aboriginal women, have not been part of that movement. And we were kind of like we were using kind of like that. Do you remember in did you do a bachelor? Did you do a Masters of Public Health?
Yeah, Masters of Public Health.
Yeah. So do you remember in your Masters of Public Health, you would have had that picture with the 3 people baseball pitchers? And you got like the wall and like equity versus equality. What we kind of looked at it was you've kind of got those 3 layers of people. You've got the one standing over the fence already, like just standing there, doesn't need the box or anything like that. That's the man. And then you've got the middle one, that's the white female. And then you've got the other one, which is anyone who isn't essentially people of color, females. And not realizing that, you can put the boxes on, but that's not going to actually solve the problem. We need to move the fence. So in order to make it like the whole issue with, I think I was like, I kind of came to this epiphany during this class. The whole issue we have with like closing the gap schemes, whatever your equivalent would be in America, I assume you have something for Native Americans where you attempt to close the gap between health and healthy and non-healthy people, but you've just widened the gap, which is what's happened in Australia. And it's because one, they don't ask, once again, I don't know the equivalent, but they don't ask the elders, which are the people who know what's best for the community, in this case, speak for the community. In a country like Australia, we have the elders of each area who speak for that part of that country, so to speak. Because each area, it's like I'm in Ghana country right now, which is a fraction of Australia. It's like not much, it's quite small as far as it goes. So like I find it really interesting to see that everything we do is about equality instead of equity. It's all about trying to make everything even, but you can't make it even because that means, like, as we know, it needs to be. They need equitable solutions, not equal solutions.
Yeah, absolutely, because we haven't had access to the same types of resources or knowledge or information. So it's kind of hard to give people the same thing and expect one group who knows how to use it to use it, and then the other group that doesn't know how to use it, isn't familiar with it, is just gonna drop by the wayside. And as you said, the health gap widens. So yeah. Definitely makes a lot of sense. I see that you're taking a lot away from your public health studies and just from a lot of interactions with other public health professionals, which I think is important. And I look forward to seeing that growth. I wanted to ask, is there anything you'd like advice on or wanted to chat more about?
Not really. As I said, most of my issue is I have such a broad range of things I like, and it makes it so hard to kind of pin down kind of advice and things like that. But no, as I said, like as always, I kind of do the odd message and say hi, how you going? I will say on a slightly different note, but when you're on my podcast, we mentioned about the food, about your Trinidadian doubles, and bro, seriously, it is so good.
It's so good, right?
I forgot I had this issue because I was rushed out of the kitchen like towards the end. I hadn't made flour like dough in like 10 years, probably longer even. So I was trying to like roll it and I kind of got like really distracted and everything. And I left it a bit too high. As you saw on the photo, it kind of rose. But seriously, it was like a donut. It was so good. It was like a donut with curry on it. It was so yum.
That's a great way that I've never heard it described before. But I'm glad that you're able to try it out. Doubles has caused me to put on way too much weight, so I've been trying to exercise as I recently got back from Trinidad. So yeah, I'm glad.
Oh, I didn't realize you went back home.
Yeah. I was there for maybe 2 weeks.
That's I hadn't even really heard of it until you mentioned you're from there, and it looks like a really cool country. It's somewhere I'd like to. I'm one of those people. I just want to travel everywhere.
Yeah. As you should. Trinidad should definitely be on the list. Definitely.
Yeah.
And now a quick break from our show sponsor. Do you care about public health and health equity? Have you been looking for value-based apparel? Well, the Public Health Store has got you covered. Rock simple, value-based design apparel that will surely have others interested in engaging in meaningful conversations with you. The Public Health Store has apparel for you to rock in class, around the office, or just casually around town. Wear your values where people can see them. Visit the Public Health Store at thephmillennial.com/shop. That's thephmillennial.com/shop. And use the code podcast for 10% off your next order. Okay, now back to the show. Well, before I move you on to the final section of the show, the Furious Five, I wanted to ask you, where would you like to see yourself in the future?
Okay, so this might sound a bit weird, but I've kind of coined this called future food systems. It's probably not coined, it's probably other people have used it as well. But I keep on that here in Australia, we're kind of like America in the sense that most of the officials, most of the people at the top of government, things like that, climate change does not exist, at least in their eyes. And because of that, I find it very hard to actually be in Australia itself. So something I'm probably going to do once I finish my degree, I will likely work in Australia for a couple of years, likely in health promotion. And then I'm looking at heading over towards Europe, likely England or somewhere like that. And a lot of that's due to the way that the whole place is changing, especially in Europe. You can really see a shift, especially looking at like when we talk about global warming in Australia, we talk about fossil fuels, we talk about cars, we talk about gas and oil and mining. But no one ever mentions the other issues. No one ever mentions the fact that animal agriculture is like one of the leading causes of climate change. I think it's ranked third worldwide, and it's the leading cause of water consumption worldwide. So when we start looking at those sorts of issues, we need to start looking at nutrition as part of the climate emergency. Some like the Lancet study, for instance, actually mentioned the only way we will hit our climate goals and the only way we will survive past 2050 is to effectively stop eating meat, at least in the way that we're eating it now. So I'm a big fan of things like clean meat or lab-grown meat, as some might call it. I'm a big fan of all those sorts of things because that knocks out the biggest issues surrounding animal agriculture, and that's the deforestation, the species extinction, the fact that, I mean, you're in Carolina, I forgot, where do you live?
Yeah, North Carolina.
Yeah, North Carolina. So you would know about your pig farms
Lots
in
of pig
poor
farms.
Black communities. Affects them so badly with their health. If anyone's seen What the Health on Netflix, highly recommend watching that one, because they actually talk a lot about a lot of public health issues. Now rewatching it once again in public health, now that I'm in public health, I see so many public health issues. One of the biggest ones being this that still stands out to me every time I watch it, every time I even think about it. It's this poor, low socioeconomic area just outside of just almost opposite a big pig farm, and all the runoff from the pigs, even though they have the big ponds of crap, so to speak, it seeps through the crap, seeps through into the water, and then when they use big sprinklers, you get let's say people get sick, the smell, everything. So looking at those things, it's a huge issue. So kind of what I want to look at doing, not so much in Australia, because I don't think that's going to change, just as it won't change in America, probably for another 10 to 15 years, give or take. You won't actively see a change. Whereas you're actively seeing this change now in England, in other countries throughout Europe. And because of that, I think I am likely to move there, depending on what happens. I could be wrong with depending on how much time it takes for it to change here. But at this point, Europe is probably where I'll end up. And I'm hoping to eventually start my own consultancy. So looking at essentially, hopefully eventually focusing on predominantly businesses and schools, hospitals, things like that, to essentially help them change their food systems. A couple of years ago, there was a hospital in Lebanon that was the first hospital to go plant-based. And basically, they just followed the studies. The issue we have with a lot of hospitals, or pretty much every hospital still, is that though it is a business, they don't realize that the way that they're doing it, the way that they go about health in a lot of cases, especially around nutrition, is wrong. We need to start looking at things like doctors need nutrition training. On average in America, Australia, most other countries, they only get about 12 to 15 hours of nutritional studies throughout their whole degree. It's not in their board, so things like that, they're to become board certified doctors, all that. It's not in their tests. And because of that, they don't learn about it. They don't see it relevant. And then you have these issues, like you see on the TV shows, where you got this guy who's diabetic and loses a toe, and then the doctor gives him a pizza at the end of the show. That actually happened in one of the shows I was watching. I turned it off after that, couldn't watch it. But that sort of thing is common in real life too. Yeah. I think that's part of the issue is we're still so, I don't know, there's so much cognitive dissonance. There we go. Which for those who don't know what that is, that's essentially where, for lack of a better term, we like to hear good things about our bad habits. We know things exist, but we haven't often, in some cases, put two and two together, especially in this day and age, because most people don't see what happens to the animals to go through, what they go through, what happens to the environment, what happens to, in some cases, what happens to their own health. I was watching a documentary recently, and Dr. Milton Mills comes on it. He's an African-American doctor, and he basically goes outright and says that what a lot of African-Americans are still eating is the same food they ate as slaves. And which leads to another interesting thing in America. You've got a lot of African-Americans who are actually going vegan as a way of reclaiming some form of control of their, same a lot of their cultural foods, because people don't realize, but originally a lot of Africa was vegan. They had meat as a ceremonial thing or as on occasion, but it wasn't like an everyday thing like it is nowadays. Which is why, once again, you see there's studies done on those sort of two different foods from different countries, things like that. And it's worse for people of color as well, especially things like milk. It affects people of color far worse than would a lactose intolerant white person, just purely because of how long we've been drinking it for.
Yeah.
So I'm lactose intolerant, but it doesn't really affect me. But African American or Aboriginal person here in Australia can really affect them far more with bowel issues and other things as well. And but because the government says we should be drinking it, you've got this whole other issue where, because they say we should be drinking it, they assume they're supposed to drink milk. As I said, that sort of issue. So I'd like to eventually start changing these systems, for like a bad term. Critical public health was a term I came across, where we start critically thinking about what needs to change and how we can fix it. And essentially that's all I want to do. There's so many issues, but the biggest one there for me is nutrition. Considering pretty much every one of our leading causes of death, other than accidents, are caused by chronic diseases. And in particular, those chronic diseases are caused by our lifestyles, and in particular, our diets. Until we fix our diets, we can't fix anything else. And it kind of wraps around, if that makes sense. So yeah, that's what I'd like to eventually do in the future.
Yeah, absolutely makes sense. Future food
Sorry
systems.
for going off on that tangent again.
You're okay. You're okay. All useful information. But yeah, I definitely think looking forward to like the future food system. And I think a lot of what you're talking about is what I'm thinking about is how do we create like the culture of change, culture of health? Because as we know in the health systems, it's not a culture of health. You go to any hospital now, you will see a bunch of fast food restaurants in there. So it's like, really, how are we changing the culture around health? And I'll push back on like the Africa being vegan. I would say Africa is probably plant-based or mostly plant-based.
Because, that's a better term.
Yeah, because the root of where it comes from is different. Yeah. But yeah, I appreciate all of that. I look forward to seeing how all that unfolds for you, and we could definitely hop back on to chat more about like that particularly, because I think you have a lot of information and insights that you'd be able to share from your perspectives. So let's try to do that at some point.
Definitely, I know, anytime, anywhere.
Awesome. Anyway, I'll take you up on that. So moving on to the last section of the show, the Furious Five, the 5 questions I ask all guests. So from your perspective as a current student and podcaster, what advice would you give to students trying to pursue a career in public health?
Well, first of all, for people wanting to look at health degrees themselves, I would say consider public health. The amount of people even you've spoken to who have started with like a bachelor's of, say, a doctorate, for instance, like becoming a doctor, and then realize at the end of their degree, oh shit, I wanted to be a public health person. And the same with social work, same with all these different things. It's like the amount of people you've spoken to who, if they heard about it earlier, they've literally said they probably would have done it beforehand or done that instead of. I think that's something. So if you've heard of public health and you still don't know what it is, but are looking at health degrees, look more into public health, I think. Like a lot of people don't do this in university nowadays, but I would recommend anyway. Join clubs, make friends, make contacts. Those sorts of things I find is really kind of vital. Our contacts in some cases are like at those connections, that networking, because schools don't, unless you're studying business, you aren't taught it. So you often have to go out of your way to learn it. And sometimes it's simple as just saying hi. Where possible, I recommend get off the online crap. Go face to face. You learn more, you meet people, and you can immerse yourself in that university-college life, depending on where you are in the world. So yeah, just do it essentially.
Great advice. Number 2, if you were talking to someone wanting to start a podcast, what advice would you give them?
I suppose have a plan. Kind of understand why you might want to do this. Podcasts aren't necessarily easy, especially like for someone. I mean, I remember your first probably 10 podcasts of you kind of not knowing too much of what to do, I don't know if you've learned how to edit yet, but like that's another big one there. It's like if you can, those sorts of things help. But in saying that, when it comes to actually doing it, once again, just do it. I think my biggest regret with podcasting is I put it off for a long time. I thought about doing this not long after I went vegan, and I think I was almost 10 months before putting it off. Now, I don't know what you use, but for my podcast, I use Anchor. It's a free website which allows me to upload to Anchor itself, to Apple Podcasts, to Spotify, and numerous others as well. And it's free. So something like that is perfect. It's absolutely ideal. And if you want, you can even record it on the app. So like that sort of thing is absolutely phenomenal in this day and age. Something I do with my podcast is I look at podcasters I like. For instance, I looked at yours, and I looked at was it Public Health Insight and what's the other, Public Health on Call, those sorts of groups. I looked at what they were doing, and I essentially use some of their sorts of things. I mean, I use one of your questions at the start, what does public health mean to you? So I use those sorts of similar questions. I find that kind of getting ideas off other people is a good idea, especially if you're new to it. And then eventually you create your own style, what you like, what you don't like. And also listen to your podcasts. Listen to your own podcasts, because you'll realize at the start you do a lot of ums and ahs and a lot of things that you may not like. So yeah, if you can, try and fix it. Become aware of the ums and ahs and those sorts of different things. I will say once again, that same sort of thing as I said with the people trying to pursue a career in public health, same idea, just do it. The more you put it off, the harder it gets to do, and especially with something like this, especially if you haven't in the past talked to people, it can be a little bit difficult for you to do. But if you want to do podcasts by yourself, do it. There's some really good little podcast kits out there. I got my first one through, actually all of my podcast kits have been through Rode, but even just a plug and play USB, NT USB Rode mic. It's literally you plug it into your computer and automatically you can do whatever you want with it. You can record, you can do, I did my first podcast, the one I did with you, I had my NT USB by that point. I think I just got it. And now I've got this new really cool podcast rig, which I'm using at the moment. So yeah, no, it's just, I suppose don't go all in all at once as well, which is the other thing kind of leads me to what I just said there. It took me 2 years to decide to actually get something like what I've got now, because the amount of podcasts that fail because either people get bored or run out of time or they're doing it for the fame. That's the other thing. Don't do it for the sake of doing a podcast. Do it because you actually enjoy it. Otherwise, it bores everyone, and we don't want boring podcasts. We want interesting podcasts. So yeah, kind of find your why with your podcasts as well.
Yeah, great advice. And definitely just start. Something that I always, when I re-listen to episodes, is that's awesome. I say that's awesome way too much. And it's something that I'm actively trying to not say as much.
When I started, my biggest one was and and that and I did that on my accent. Yeah. I always do that. I do that a lot as well.
Just learn, and you continue to grow, but you definitely have to start, and once you start, it gets easier from there. Number 3, what's something you're working on improving in your life right now?
Well, I want my nutrition. I'm one of those people throughout my life. I've been one of those ones, do as I say, not as I do. And because of that, I also my history, kind of going back to the history thing as well, especially with my food. Once again, back as a kid, sort of very late teens, I fell into a minor binge eating disorder, kind of just eating my feelings. Something I registered a lot later on. Well, I mean, depending on what you consider a lot later on. But I kind of realized what I was doing. When I realized that, I was like, well, how can I and I kind of essentially needed to be a bit more aware of it. And when I realized I was like what was happening and things, I think veganism also helped with that as well. It helped me it's helped me a bit with the binge eating itself. I still need to physically improve my nutrition. My diploma in nutrition gave me the skills, but they didn't teach you how to implement them, which is a bit annoying. And the other thing I've just started doing as well. So I just moved across the road from my school. So I'm actually at the school right now. I do my podcasting at the school because they've got these really cool little booths. And it's like really good for podcasting because they're pretty quiet and in good location. But no, also because I moved, I also live directly across the road from the school gym. And because I live across the road from the gym, I'm actually using it now. So I've just started using the gym. I actually got a personal trainer for the first time as well. So I'm actually trying to actively do that sort of thing. I'm never going to be good at reading, like actively reading, but something I've started to do a lot recently is audiobooks. So I've been starting to read it. Like I've been off and on audiobooks for a while, but I'm back on at the moment. I've read some really, really cool ones lately, which is so I suppose at the moment, other than that, not too much, I don't think. Attempting to get some better sleep. That might be the only other one. Is I'm not the best sleeper, especially now that I've moved. I'm in a single bed, and I spent the better part of the last 3 years in big queen size beds. That's really weird to sleep. So I'm always worried I'm going to fall out of the bed. So trying to rework my sleep patterns and everything, I suppose, as well.
Well, I hope that you're able to find some comfort in that new bed, as well as I love that for you. I hope that you're able to better improve both your individual wellness in both the nutrition side and in the physical activity side. So look forward to seeing that progress there.
Well, you've seen it a little bit there on on your Discord channel.
Yeah,
I've posted a few times there when there's such a good view from the gym, so it's really cool because it has. For those who don't know, Adelaide is in this really weird shape, but it sits kind of like in a weird bay almost. And Flinders University itself sits on just below, kind of on the tips of the hills, just before it starts going further higher and higher. But the view from the main campus, you can actually see all the way out to the ocean. So when you're doing gym and stuff, you can actually see the ocean from like as you're running, and you can see the ocean from the treadmills and everything like that, which is really cool.
Yeah, it's awesome. And keep posting in Discord group if anyone else wants to join, the phmillennial.com/join, and you can meet Jamil and myself in the Discord group. Number 4.
And other awesome people.
Yeah, absolutely.
Yeah, Equity Jazz, isn't it?
Yeah, Health Equity Jazz. Yeah, she's in there too.
The yoga person that always I don't know who she is off the top of my head, but this girl who always posts yoga YouTubes.
Win.
Yeah. There's a few others there as well. Yeah. So I suppose. Yeah.
Love it. Number 4, professionally, do you recommend anything?
Okay, where do we start? Okay. I suppose for books, I always go back to that one I just mentioned before. We mentioned at the start, the China study. Mm-hmm. So anyone interested in nutrition, things like that, the China study is a good one. It is a little bit old though, and it is a very big read and kind of boring. I hate to break it, but it is very boring. So possibly the audiobook version of that's probably a little bit better. Another one there as well with the nutritional sort of things is Dr. Greger's books, How Not to Die and How Not to Diet. They're both really good, and he's a really, really good really good doctor as well. He predominantly focuses on that sort of thing. Another one, once again, a little bit different. It's more about kind of making you better rather than about professionally itself. But a book, Finding Ultra by Rich Roll. Very interesting book. A lot of kind of has a history, his history is quite interesting, and went essentially from being a not very fit person to running ultra marathons as a vegan. So like he's had a pretty interesting life. He's also a podcaster. You might have come across the Rich Roll podcast. That's another one I actually recommend as a podcast, is the Rich Roll podcast. He interviews amazing people all over the world, really interesting stories. It's not a vegan podcast, though coincidentally some of his guests are plant-based and vegan. It's not a vegan podcast, so to speak. So yeah, no, other than that, I suppose my podcast, obviously I'd recommend that. Yours, other podcasts, we've got the Public Health Insight, which are some Canadian guys who do really, really good podcast. They're not long out of their master's programs and things like that, but they're really, really well educated and they've done really well with their podcast. Public Health on Call, if you want to learn about public health news and things like that. YouTube, I would probably go for it's Greg. I don't know. He's been doing public health YouTube for like years.
The guy with glasses.
Yeah, Greg, someone or other.
Yeah, I know who you're talking about, but I don't know.
Yeah, I've got him on LinkedIn too, so I should know it. Yeah, and I hate it when that happens. I suppose for shows, movies, things like that, I would highly recommend Dope Sick. That one's on not Netflix. Google Plus. Disney Plus. Sorry. Okay. Really, really good one. It's about the opioid crisis in America and kind of what started it. It's really interesting. I highly recommend that one. I'll leave it at that. I mean, I can think of so many others, but I'll leave it at that. It'd be nice for you. Don't want to send a week retire on. What's gonna call it? So yeah.
Yeah, well, I appreciate you sharing that resource list, and I'll be sure to link those so people can check them out if they're interested. And then the last question, but definitely not the least, is where can people connect with you, Jamil?
Okay, so generally speaking, for public health, I prefer people to connect with me to LinkedIn, which is Jamil Locker on LinkedIn. There'll be a link on there on the show notes. And then if people want to kind of reach out to me for like about veganism, things like that, I would generally go for the WTF Vegan. It's just a bit easier. I generally don't do too much stuff about my public health on my vegan channel. I don't, and vice versa. I don't try to do too much veganism in my public health stuff where possible. There are some overlap, but in general, I don't actively do too much with them together yet. As well, if anyone who's listening wants to be on my podcast, feel free to reach out to me. I'm interested in pretty much anyone in public health, even students, those sorts of things, like even even if you're just slightly out of public health, generally speaking, like social work, things like that, I always find them valuable to public health. So it's really cool to talk to you guys as well. Once again, just through my LinkedIn. So if you ever want to be a guest, let me know.
Well, thank you so much for coming on and sharing about your story and all that you're doing. Look forward to seeing how your journey unfolds. It is definitely the early part of your career, and I'm excited that you have like 2 podcasts already, that you're like interested in this type of work, and I'm looking forward to seeing how this grows. So housekeeping items, everyone. Thank you so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a 5-star review, leave a comment with that review, and share it with a friend. Greatly helps out the show and helps get it out to more people so that they can better understand public health and navigate their careers. And as Jamil said, join the Discord group. Go to thephmillennial.com/join, and you can connect with us there, ask questions, really focus not only on public and community health, but also on our individual well-being. Thank you all so much for tuning in. Peace.